So welcome everybody. My name's Sophie Chester-Glynn and I am heading up an organisation called Coproduce Care, and I'm really excited for anyone who does follow our YouTube and our chats, Coproduce Care chats. This is a really different one, and I feel like it's probably one of the more important live streams that we've ever done, because this is all to do about the Covid-19 vaccine and vaccination. I know there's lots of vaccines out there. So I'm not going to spend too much time introducing myself and the organisation like I normally do, because I've got a fantastic set of panellists with me this evening, more than we've ever had on an evening. And we're specifically going to concentrate on your questions about vaccination. So Q&As about what you want to know about vaccination. I know there's been an announcement recently, a press conference about vaccination and the virus and different mutations of the virus, and there's going to be so much to talk about, which I'm not going to go into, but I do have a fantastic panel. So if you've got questions, just put them in the chat. Please feel free to ask your questions live, but we've been very lucky to have a whole host of questions that people have handed in beforehand. And I know I can see most of the questions up here. Some of them are going to be on my phone, which the panelists can't see, but I'll filter as many of your questions about vaccination as I can through to our panel. And one thing I would say, though, is the whole reason why we kickstarted this is back in November, we went out to people in social care to find out, would you take the vaccine when it becomes available, and if not, why not? And we had a whole host of issues and hesitations that people had. So we thought we'd do something like this in the new year to try and help people have their questions answered. Very casual, it's really relaxed, and no question is too daft. That's the tagline for this evening. So anything that you have queries about and you're thinking, I'm not quite sure who to ask, I don't want to ask anyone and sound a little bit silly, then do pop it in the chat. And if you are just wanting to listen, then you can just do that as well. There'll be plenty of opportunity. So just to give a little bit of a flavour, I'm going to ask our panellists to introduce themselves so you can understand their specialisms. Then we're going to do Q&As for about just over an hour and a quarter, and then I'm going to play out a few videos that we've had. I've had an interview with a professor who will go through probably what we're going to cover already, but I will play that anyway. He can join us live tonight. And then also a message from the MP, Thangam Debonair, and also some information specifically on social care. So do stick around even when we have finished with our Q&A session. And of course, as always, to bring more people into the stream who you know might be really hesitant about the vaccine, or maybe just don't want to have it at all, or just have a general query and are still going to take it anyway. Please share that if you're listening to us on Facebook or YouTube, then you can share it, this link, you can like it, and obviously if you're wanting to like our page, please do that and subscribe, because that brings more people to this recording, and it will be recorded so you can watch back at any point. If you've only just joined us, you can go back live. That's the great thing about live streams. So that's enough from me. I will have a little proviso as well, that if you do have any specific issues around your own health and the vaccine, or which vaccine, then do obviously look at any information that's out there that's on the government website, and also your own GP. But any other questions that you've got, or just general questions, then feel free to ask them tonight, and we'll do our best to answer them. And I will try not to cough myself through this, because I do have a little bit of a cough, but it's not COVID related. So I think that's enough from me for the moment. I'm just going to introduce our panelists. There are quite a few of them. Bear with me. Great. So what I will do is I'm just on my screen go through people, and if you could just unmute yourselves and just say your name and where you're from, where you're located at the moment, and also if you have any specific specialisms, what they are. So can I start with Nilu, please?
Hello everyone, my name is Niloufar Ahmed. I'm a lecturer at the University of Bristol. I'm a psychologist, and my specialism here is working with minority communities and understanding how people's behaviours respond to the pandemic.
Great, thank you. And Jaya?
Hello. Hi, I'm Jaya Chatterjee. I'm one of the GP trainees in the East of England Deanery. I'm currently working at the Basildon and Thurrock University hospitals. I have worked in the medicine department recently with COVID patients, and I'm posted in the obstetrics and gynecology department. My special area of interest is women's health, and that's what I would like to pursue my career in GP. Thank you.
Great, thank you, Jaya. And Tom?
Hi, good evening. My name is Tom Fletcher. I'm an infectious diseases consultant in Liverpool and academic at the Liverpool School of Tropical Medicine. My work is mainly looking after patients with severe COVID in Liverpool or admitted to hospital. And then I lead a sort of a research portfolio that looks at emerging viruses and new treatments for COVID-19. Thank you.
Great, thank you. And Latha?
Hi, good evening. My name's Dr. Latha Weston. I'm a consultant psychiatrist in London, and I also sit on a research ethics committee, which is part of the Health Research Authority, looking at application of medicines and their usage. So I hope to be able to shed some light on that should there be any questions. Thank you.
Great, thank you, Latha. And I know there is a little bit of lag on your line, but we can hear you perfectly, so that's wonderful. And next person I have is Sayi.
Evening, everybody. I'm very pleased to be part of this panel. My name is Dr. Padmasai Populani. I'm a consultant in infectious diseases and acute medicine at Ealing and Northwick Park Hospitals in Northwest London. I look after COVID patients, have been for the past year. I also am involved in a number of research trials related to COVID, and I sit on the professional expert panel of UK REACH, which is a national study looking at ethnicity and healthcare workers in COVID.
Great, thank you. And Brighton? Brighton, you might need to unmute that. Okay. Yeah.
Okay.
Go ahead.
Thank you very much. My name is Brighton Chiraka. I'm a GP here in Folkestone, Kent, and I'm also a certified lifestyle physician. I'm also the co-chair of BMA Southeast Coastal BEM network, and I'm very passionate about patient engagement and also public engagement.
Great, thank you for that introduction, Brighton. And Edwina.
Good evening, everyone. I'm Edwina. I'm a GP in North London. I'm looking forward to answering your questions to the best of my ability alongside the rest of the panel. I have been looking after patients with coronavirus in the last year, mainly in the community.
Excellent. Thank you so much. I feel so lucky to have you all here tonight. I'm really grateful for taking your time to spend with us. We are going to go through some of the questions that have been pre-submitted because people have actually filled out a questionnaire. But before we do that, I wondered if I could ask some people who are working with people who have COVID-19 now, just to go through their experiences of what it's like and what people are experiencing at the moment. And I wonder if I could come first to Tom, because I know we've talked about this a little bit in our prep session.
Oh yeah, thanks, Sophie. I think it is probably useful to understand as we talk about vaccines what the impact of infection means. As many people know, the majority of people who get COVID-19 remain relatively well and have a mild illness with fever and cough and stay at home. However, we know that people with other medical problems, and as you get older, you're more likely to end up in hospital. That's normally the case when people require additional oxygen therapy, and of those, some end up requiring a lot of oxygen and then end up in intensive care. And we know that those who go to intensive care, despite the best efforts that can be delivered, still unfortunately about half those people die. So I think as we were chatting sort of earlier in the week, Sophie, sort of for all the healthcare workers in the front line, I think in primary care, but in hospital too, who see the effects of this virus, are sort of very keen now that the vaccine is taken up, particularly amongst carers and healthcare workers, because we know the impact it has on our patients, really. And despite the best efforts that we can give to treat patients, sometimes, a fair number of them will still pass away. So yeah, I think we're now on our third wave in Liverpool, about 500 patients in the hospital as of today, but fortunately on its way down.
That's good news, really good news. And I know that, say, you're also in a similar position where you're working with people who have COVID-19. Could you just give a little bit of an insight into what you're seeing at the moment?
Yeah, I guess I reiterate what Thomas just said, that, we, in the first wave, we really were seeing many patients who couldn't stay at home. So these were people working in either social care or healthcare, and also those who work in the gig economy. So a lot of taxi drivers, people who work in shops. In this particular wave, we're seeing, the virus, we've seen that in the numbers really spread very rapidly, and lots of people are affected. And, I think if you have personal experience of having COVID yourself and having family members who've had COVID, and seeing, your patients, these are, often young patients who don't have any medical problems, and, despite our best efforts, people are still dying. And that's why, I really am an advocate for vaccines, because it's part of kind of a multi-pronged approach of trying to get the virus under control. And, I think particularly in these past couple of months, really everyone is becoming affected by COVID, in that, I felt in the first wave, people, it was quite limited in terms of how many people knew a person who had COVID. But this is, with 100,000 people, or more than 100,000 people who've died in the UK of COVID, everyone is being touched by this virus. And we all have to think, how are we going to, as a country, get out of this?
Yeah, thank you for that insight. And Edwina, you also mentioned that you're working with people who are experiencing COVID in the community. Is your experience did you want to add to the experiences that we've just heard?
No, I echo what Tom and Sai have mentioned. And I think for GPs in the community, what we're also finding is the long-term effects of the COVID as well. So for the patients who have had a milder illness or moderate illness and have recovered, in inverted commas, we're still finding that they're having symptoms going on weeks, months after the illness, limiting their ability to go back to work, for example, look after their loved ones. So it's not just about the acute illness, but it's also the long-term effects that a lot of patients seem to have, otherwise known as the post-COVID syndrome.
Yeah, and there is a question about long COVID, but I think we'll get on to the other questions first. And I wanted to really start off with sort of what is vaccination? Is the vaccine safe, and what does the vaccine contain? So might I go to Jaya for that to start us off?
Yeah. Hi, Sophie. Yeah. So we have had these researches going on, and we are very grateful that scientists have come up with the vaccine, which we know could be one of the answers to sort of stop this rapidly growing pandemic. So as of now, the UK, we have 3 vaccines which the MHRA has authorized, which we know are the Pfizer-BioNTech, the Oxford AstraZeneca, and the Moderna vaccine. We already have all 12 million people as of today. I think more than 12 million have already received the first dose of either of the vaccines. So I think that's really very good in that process of getting a grip on this pandemic what we have had. So as we know that the Pfizer vaccine is an mRNA vaccine, which sort of has, though the technology is new, but the research has been going on with the mRNA vaccine for quite a while. And so basically, when we receive the vaccine, it's the body, the mRNA produces is the spike protein of the coronavirus, and the body produces the spike protein when the vaccine is introduced. And so whenever, if a person gets infected with COVID, the body is aware of this sort of antigen, and it can prepare the antibodies, and so we can have a mild illness. So that's what the vaccine is about.
Yeah, thank you. And Dr. Brighton, you said that you've had the vaccine already. And in terms of side effects and how it feels, one of the questions is about side effects and how it feels after you've had the vaccine. Oops. You might need to just unmute. There we are.
Thank you very much. I've had on the 13th of January, and I was expecting to get some side effects, which I've heard people talking about, but I never had any problems. But talking to some of my colleagues, we have had, they're telling me that they're getting a bit of headache and also feeling a bit feverish and tired. But this lasts for only 1 or 2 days. And those who may have headache, they take paracetamol, and after that, they are fine. So to me, whether you take vaccine, AstraZeneca, whether you take, wife took Pfizer, and she was also fine, no symptoms, no side effects. I thought maybe myself, I was eager, that's why I did not get any side effect, but my wife also took it and did not have any side effects. So the majority of people are not getting any side effects. Even those that are getting the side effects, they're getting mild of them.
Okay, that's really helpful. Thank you for that. Another question is quite specific. Has the vaccine got gelatin or anything which people of the Muslim faith cannot have? And is the vaccine halal? Is anyone able to answer to that? Edwina?
Hi, Sophie. I will have to look it up. I believe from what I've heard.
But I have someone also. Yeah, so unmute yourself.
Yeah, so the vaccine doesn't contain any animal products, so it's suitable for people who don't, take pork or beef or gelatin, any kind of gelatin products. And in fact, actually, in East London, the East End Mosque is being used as a vaccination centre. There are resources on the internet. If you have particular concerns from your faith about vaccines, but I think there's been a lot of promotion, from imams and the Muslim Council of Great Britain that the vaccine is safe and encouraging Muslims and other faiths to take it up.
Great, thank you. That's really, really helpful. And there are, like Jaya said, there are quite a few vaccines out there. For anyone who's administering them at the moment, can you choose which vaccine out of the many that are available? Is anyone okay to answer that? Feel free to raise your hand if you've had experience. Oh, Edwina, thank you.
So at the moment, at least in North London, I think most places, we've got the Pfizer vaccine and the Oxford AstraZeneca vaccine being rolled out. They're both good, and we recommend that when you do attend the vaccination center, you take the vaccine you're offered. The problem is, a lot of the time when people arrive, there's only one vaccine available, and this has to do with logistics, storage, and transport. So there's not really a choice, but there are some people in certain situations where the Oxford AstraZeneca vaccine will be offered in place of Pfizer. And that's for people who have a severe allergic reaction to medications or a history of anaphylaxis, because we have had people react very badly to Pfizer, and it's less so with the Oxford AstraZeneca vaccine. So in that case, they would almost be offered the Oxford AstraZeneca vaccine instead. But really, it's about receiving what you're offered on the day, because usually it would be what's available versus a choice, as it were.
Okay, thank you. That's really helpful. I know I'm looking away from the screen, people, but it's just because I've got the questions here on my other screen. So we did touch on long-term effects, and that was one of the questions that's come up. So what can be the long-term effects of COVID-19? I don't know whether those who are dealing with people in hospital now can talk to that, or whether one of the GPs can answer that question. I suppose it's the idea of long COVID. You hear that talked about a lot. What even is long COVID? And because obviously, I suppose the option is to just maybe get the virus and then you're immune to it, but there potentially are some long-term effects as well. So people are asking, what are the long-term effects of getting COVID? Anyone want to put their hand up whilst I'll pick someone? Oh, lovely. Thank you. Say.
So within hospitals, some of the long-term effects we are seeing are to do with the respiratory system, and people having ongoing symptoms of breathlessness, particularly on exertion, and cough. But I think long COVID needs to be considered as a constellation of different systems, different symptoms affecting different systems. So some people are experiencing more kind of rheumatological, things like arthritis, that type of manifestation. Some neurological, with headaches. Fatigue appears to be a major issue. There have been effects. The unusual symptom of this virus was the lack of smell and taste that people were experiencing, and sometimes that has been affecting people's smell, ability to smell, and also their hearing for a long period after. It's something that we're still learning about, because it has only been 1 year after the first cases were reported. But it also goes to show that, as well as the acute illness, we really want to try and prevent this virus, because we don't want the morbidity from long COVID and the effects on people in terms of their daily lives and their ability to work and their family life.
Thank you. That's really helpful insight, actually. I noticed that someone's put a question out, and I'm not sure if anyone can answer this, but let me know if you can. And that is, are all the vaccines linked to testing on human embryos? I've not heard about that before, but if anyone is able to answer that, please do. If not, then we can always take it away and add something on our website. I did fail to mention that we are collecting some useful links on our website, so and some of the panelists have actually sent us links to add to that. So coproducecare.com, you'll find it, vaccines Q&A on our website. But Brighton, have you unmuted yourself to answer that question, or there might be a bit of lag on your line?
The vaccines, if you look at the Pfizer, can you hear me?
I can hear you. It's just that there's a bit of a lag.
The vaccine, the Pfizer vaccine. Okay, I'll sort out and then come back if someone can take the question. Sorry.
Okay, well, we might just wait for you to come back in then. There's another question of a few of our staff are worried about having the vaccine, as they're trying for a family? Is there the risk for either fertility or if you are pregnant? And I was really hoping this question would come up because I'm also 8 months pregnant, so I wouldn't mind hearing the answer on this one. But I also know there's quite a few of us, quite a few of the panelists who are able to talk to this one on pregnancy. So who would like to go first on pregnancy and fertility? Edwina, can I come to you?
Hi. So I think I'll take one after another. So fertility, I've been to quite a few webinars. I have read the Royal College of Obstetrician and Gynecology statement on this. And they've said that in similar vaccinations, there's been no risk of an impact on fertility for women. Okay, so obviously it's not been tested long enough to see what the impact might be, but comparing it to similar vaccines in the past, there's no evidence that this should impact women or men's fertility negatively. With regards to being pregnant and whether or not you should have the vaccine, that's a very individual discussion that you have to have with your GP and your antenatal team. Reason being, the vaccine is obviously being given with good intention, and we know what the benefits of the vaccine are, but it's not being tested on pregnant women. So there is obviously a risk-benefit balance conversation to have. We do know that, for example, doctors, nurses, those who work in ITU are at increased risk of exposure to this virus. And so we recommend and we want to encourage vaccination in those groups, but still it's an individualized conversation and discussion with your GP and your team. But we want to encourage those who are at risk of getting the coronavirus or getting severe illness from the coronavirus to have a conversation with their doctors and strongly consider vaccination. I also have some links I can post in the chat as well with regards to this, some statements from the Royal College of GPs and also from other teams about fertility and pregnancy and the coronavirus vaccine.
Yeah, great. I mean, we have actually put those as well on our website, so do have a look if you're not able to do that in the chat. Did anybody else want to add to that question on fertility and pregnancy, or are we happy with that? Oh yes, a few hands. I'll go to Jaya, and then I'll come to Sai, and then I'll go to Brighton. So Jaya first.
Yeah, so as Edwina mentioned, I think the JCVI have updated their recommendation regarding pregnancy and breastfeeding as well. So they have said that pregnant women who are in the highly clinically vulnerable group, as well as women who are at risk of acquiring coronavirus because of where they work, like doctors, social workers, they have said that it has to be, an individualized decision, and women should be given with all the information so that they can make an informed decision whether they want to take this vaccine or not. We know that women are given non-live vaccines like the flu vaccine during their pregnancy at any time of the pregnancy, and their recommendation is based on the fact that even this is a non-live vaccine, so most likely it should not cause any issues with the pregnancy. But obviously the trial groups did not have pregnant women, so we don't know for sure. But it has to be a very individual decision made with the woman, the pregnant lady, with the GP and the antenatal team being involved.
Great, thank you. And Saeed, did you want to add anything to that?
Just to say that even though pregnant women were excluded from the vaccine trials, there were a number of pregnancies, like accidental, not kind of planned pregnancies during those trials in participants. So, to my knowledge, those pregnancies, there have not been any complications during those pregnancies. So, I think people can also be reassured by that knowledge as well.
Great. And Tom, yeah.
Yeah, I was actually just going to comment a little bit, Sophie, on the previous question that I think came up about embryonic cell lines. So I think this has been a concern before, and I think it relates to the previous question that we had about people of specific faiths being worried about the constituents and where the vaccine has come from. So many vaccines use different cell lines, sometimes human embryonic cells or animal-based cells to develop those vaccines. In this sense, the Oxford vaccine has used embryonic cells as part of its development chain, but actually that's been reviewed by a number of faiths, I think including the Pope, who has come out to say that that is actually fine to receive that vaccine in line with not using in line with using embryonic cells. You know, much like the Muslim Council of Great Britain has come out to recognise the use of the vaccine too. The Pfizer vaccine and others doesn't include that pathway at all, but so I hope that answers the question, that it does, but I think the faith leaders have come out to say, you know, the benefit of receiving this vaccine greatly outweighs potentially some misconcerns that people might have had of its origin, you know, a long time ago in cell lines.
Great, really helpful. And Brighton, can we test your connection again and see if you can answer the question again, that question again as well? Add anything to it?
Yeah, no. What Tommy has said is what I was going to say. But I just wanted to also to say more on what panacea said about pregnancies that have happened since the vaccination. We have had people that have given birth and there's no problem. So those who may be pregnant, they should not fear much, but has already been said by Edwina, by also my colleagues, that it's an individualized risk. But what people should understand is, if you are someone who is high risk, for example, you may have diabetes, you may have asthma, and all those things, it means if you get COVID, you get a severe form. As Tom has told us, 50% of people who are going into ICU are not making it. So when you look at those, the risk of getting a severe form of COVID, I would be persuaded to go for the vaccination.
Very helpful. Thank you so much for that. I'm going to just ask, I'm going to bring in Latha here for this question, if we can, because there's a question around about which we had in our report. This one came through, and it's people asking, you know, how has the vaccine been developed so quickly? You know, have any corners being cut? And I know, Latha, from your point of view, you actually sit on the research ethics committee, and it might be quite helpful to understand, you know, what is a research ethics committee, what does it do, and how does it assure that certain procedures are gone through to make sure that something like vaccinations are safe for people?
Yeah, certainly. Thank you, Sophie. So basically, any medicine that is approved or is approved for use in humans has to go through a lot of regulatory processes. So basically means that lots of checks are done, and a vaccine is like any other medicine, really. So it has to go through numerous processes from the point at which it's developed to the point at which it's actually injected into people, and all of the research kind of regulations and ethics have been there for a long time, basically to protect people, to make sure that unnecessary experiments aren't done on people, that they're safe as much as possible, and that any potential risks, as far as we know, are minimized, and that the benefits are more than the risks. So a vaccine, from the time at which it's developed in a laboratory and tested on the experiments are done to test whether what the vaccine's doing and how it's working, it would then be subject to the MHRA, which I think somebody's mentioned already, the Medicines Health Regulatory Authority, would also then be looking to see whether a medicine is safe and effective to use. And during the time that a vaccine is trialed in different phases, in different stages of its development, it'll be subject to lots of checks and evaluations. And the process by which something like a vaccine is used means that it's tested on a very, very small number of people first, and then slowly, as it's tested, it would go on to being tested in larger groups of people. At the same time as this regulation is being given from the Medicines Health, from the MHRA, all medicines are also subject to what's called ethical approval. And that's basically to make sure that participants, that people taking part in trials, are treated fairly, that the risks aren't too much. And this approval, as it were, is directed down to research ethics committee, and those committees consist of experts, many of whom are medical professionals who are experts, and also people who are not medics, lay people who all come with different perspectives. And it's the committee's job to look and see whether the trials are being conducted in a safe way, broadly speaking, but most importantly, that participants are not being put at any risk. And we're able to ask questions of how the trials are being run and what's happening. And during the pandemic, what happens is that all the processes that are normally there are all in place, but there is definitely a lot of desire to make sure that things move quickly and much more effectively than perhaps they might do were the time not quite so sort of urgent. So therefore, things that might take a long time to approve, for example, from discussion to then asking questions, all get speeded up. So it's nothing, none of the processes are omitted, but some of them take place a little bit more quickly in terms of things like ethical approval, but the trials themselves still go through all the right processes and all the right procedures. And because there are so many sort of different aspects of looking at these medicines and how they are then moved from just being an experiment to actually being injected into people, for example, I think there are lots and lots of checks to make sure that these vaccines, for example, are as safe as is possible, and not just that they're as safe as possible, but that they're regularly evaluated at each stage to make sure that no unexpected things are coming up, etc. So I hope that explains some of what you're asking.
That was really, really helpful. And if any, I'm going to take Latha out of the stream just for now, but if anybody has a question specifically on anything that Latha has mentioned, then do just put it in the chat and we'll bring her in to answer that. Yes. But thank you. Thank you. That was really, really helpful. A couple of questions have come up, and I'm just going to show them on here. So Jerry's asking, if you have a history of unpredictable anaphylaxis, can you still have the vaccine? If so, which one? And are any additional precautions required? So I'm just going to take it down so I can see everybody. Yeah. Does anybody want to speak to that specific question? I know it's quite specific. Brighton, if you unmuted to answer that. Yeah, great.
Okay, so I'm one of the vaccinators. We are vaccinating people. So we are asking people about their allergies. So I'm just going to give a broad answer so that if people have got all questions on that, they can also get answered. So if we are asking people about any allergies, for example, any allergies to any drugs or food. If anyone has got allergies of drugs, there's no problem as long as whatever they're allergic to is not part of what is in the vaccines. Because most of these vaccines, they don't have much things in them, so you can have your vaccine. But if you have had anaphylactic shock, people have to understand anaphylactic shock is whereby you needed to be taken into hospital because you couldn't breathe and all that. Not just a rash, not that having diarrhea or vomiting. That's not an allergy. When we talk about an allergy, anaphylactic shock, or we're talking about whereby you have to get into hospital to be able to breathe. If you have had that such an allergy, then we are not vaccinating you. You may have to talk with your doctor, and then they may arrange whether you can be vaccinated in the hospital in a setup. But that will be on an individual basis, looking at your risk and your benefits. But in terms of in the community, if you have such a history, unfortunately, we are not vaccinating you. There's no which vaccine or which vaccine. Even AstraZeneca, even Pfizer, we are not if you've got a true anaphylactic reaction in the past.
Great, really helpful. Thank you for that. And I've noticed also Tim has got another question, which I want to eventually come to Nilu for. But this one is around about if staff who work in health and social care refuse to have the vaccine, does this pose a risk to them from their work and to those they work with and provide a service for? So two separate questions. So first, I presume if it pose a risk to them because they might have more exposure to people in general because they're out there on the front line. And then secondly, does that then provide more of a risk to people they support? So I suppose if you have the vaccine, does that mean you transmit the disease less? So maybe on the first one, in terms of their job role and if they refuse it, are they at more of a risk? Did I see Tom wave a hand at that? Great, thank you.
Yeah. I think the simple answer is yes and yes, right? So the reason why healthcare workers and carers have been prioritised, in the UK, particularly for vaccine delivery, is because they come at more exposure. You're more likely to see patients and look after people who are at risk of getting COVID, and then you can catch it. And we've seen, the sad effects of that with healthcare workers dying and carers dying of this disease. So clearly, the vaccine isn't 100% effective. No vaccines are, but it provides you a degree of protection. We certainly think against severe disease, and so that not having it does pose more risk to you. But I think the important part is also that second part of the question, isn't it? So, we know the lengths, particularly that carers have gone to throughout the outbreak to try and protect the people that they look after, really remarkable. And we know, unfortunately, with this disease, you can transmit the infection without even knowing it. So before you've got symptoms, for a couple of days before that, you could be looking after your participants and your carers, and it spreads so easily that you could unwittingly pass that on to a vulnerable patient or someone you're looking after. And that's the real cruelty around this disease. So unfortunately, yes, I think that is difficult. If you don't have a vaccine, you have to accept that you run the risk of getting severe disease yourself, and probably more importantly, the risk of passing that on to someone more vulnerable who may unfortunately then, also have a bad outcome.
Thank you. That was really helpful. Did anyone else want to add to that? Otherwise, I'm going to go to Brighton. You wanted to come back, did you?
Just a quick one. That all health professionals, they know that we have to be vaccinated against hepatitis B, and we have accepted that we get vaccinated. So these are things that we are used to. So it's not something new. People should understand that we are being vaccinated for us to be able to work and not infect our patients.
Great, thank you. And Tim, thank you for your question again. A follow-up. It's like I've asked you to ask this question. I haven't, but it was on our arranged questions anyway that people have been asking. And because I work in this sector, it's definitely something that's a hot topic. Can we, therefore, as employers within health and social care, can we be asking people, insisting that our employees actually take the vaccine? And for that question, I'm going to come to Nilu on this, please.
Hi. I don't think we can go down the route of insisting people get vaccinated, because that brings up a whole host of ethical considerations. What it will mean is that you may not be able to perform in your role in the way that you were performing in it without the vaccination. And that's a discussion to be had between individuals and their line managers. What I would also say is understanding why people are reluctant to have the vaccination. We had Latha very eloquently explain what the whole process of the vaccination is. Are people's reticence about it's been developed too fast, I don't know how safe it is? Is it about I don't know if this fits with my religious understandings? So only when we understand what people's reluctance is can we try and make them convinced to take on the vaccination. And there isn't a single answer that would be appropriate for everyone. But we do go back to the fact that it's an individual choice and we can't force people into taking it. And wherever your concerns are, talk to your GP, talk to your line manager. If you feel you're under pressure, you're not going to be performing in your job.
Yeah, this is a great point that you've made. And because you're kind of interested in the psychology of vaccinations and what people might call fake news or myths, is there anything that you've heard that has come up and you just want to mention that isn't true about vaccination?
Oh my goodness, so much. And I think that everyone who's heard some level of fake news will tell you something new that they've heard and that has spread like wildfire in their networks, whether it's about the constitution of those vaccinations or people falling very, very ill after them. And then once you try and dig into who forwarded you that information, what's the source, often people just know someone who knows someone who knows someone. And it's just really working with people to what their fears are and to address those. So if I think that somebody fell ill by it and they died because they got the vaccination, or they were so ill they weren't able to carry on with their daily activities, usually that's reflecting my own fear. If I take the vaccination, what if I can't get on with my daily job, or if I can't look after my own family? And it's addressing the specific concern the individual has. But so much fake news circulating, and it's just a responsibility for all of us, I think, to listen to whoever brings that fake news to us and understand and respond to it with empathy and asking questions. I always say, if you're able to, address the main concern the person has. So if somebody says, oh, they've developed this vaccination so fast, it can't be reliable, then respond to that with, it has been developed so fast, it's only been a year and it's really rapid. Then bring in some of the information that Latha's shared with us, that the ethics committees were speeding things through, clinics were open for testing on things in a way that we haven't seen before. And so you address that concern, but you also bring in some additional information that that person can process and share with their networks.
Yeah. I've noticed someone has asked a question about can we choose. We have actually covered that, Nicholas. So maybe if you want to go back, just wind back a bit earlier about which vaccine you can choose. And we have talked about side effects already. I know that you've just put in the chat that you're concerned at how elderly people will feel, and that's slightly nuanced to what we talked about earlier. So specifically, obviously, if some people do have side effects from vaccination, and a lot of us support people who are in that 80 or 70 plus cohort, those side effects might be quite bad for them. Should we worry any more for any of the side effects for older people? Does anybody want to pick that up specifically, Tom? Yes, thank you.
No, so I mean, as we said before, obviously people who are older have the most benefit from the vaccination because they're the most at risk of ending in hospital. So you should start from that position. But actually, in the trial data so far, elderly patients actually have had less side effects than younger participants. So if anything, their risk is less. I mean, fundamentally, all the regulators who've approved the UK vaccines that we're using in multiple different countries are confident around the safety of the vaccine. Most of those side effects in terms of a fever or a bit of a sore arm after the vaccine is a demonstration that your immune response is working, that actually it's responding to this vaccine, starting to generate antibodies and an immune response against the vaccine as it is meant to. And the risk of severe side effects, such as we heard the allergic reactions or anaphylaxis, is also pretty rare. So, you know, down at 1 in 100,000 or greater. So really rare for most people who are going to get the vaccine. And there's particular things put in place in the vaccine centres as Brighton works in to manage that low but real risk that people can have a reaction to it.
Great, helpful. Brighton, did you want to add? Yeah.
Yeah, as Tommy is already alluded to, we have managed to vaccinate all our patients who are 80 years and above, and we have never had any problems. And we have never, I don't want to test fate, but we've never had anyone getting an anaphylactic shock. So what I can say to people is that this is a safe vaccine because we have not had any problems with elderly people. So even the one that we are vaccinating, we have not had any major problems. So to me, I would say the elderly, as Tony has said, they're actually stronger because they're actually having no problems.
Great, thank you. Julie's asking, what protection will we have from the first vaccine? Great question. Who can I go for? Nominate yourselves. I'll pick on somebody. Edwina, maybe do you want to add your knowledge of how safe after one jab from any of the vaccines, or maybe it varies?
I think the data is still coming out, but from the other panelists can fill in as well. From what I've read, even just one vaccine provides you with pretty good going protection. Obviously, we say to most people that starts about 2 weeks after the vaccine, and our recommendation is still to have the second dose. And nothing is 100%. So even when we're vaccinating patients, we say, look, this is just another line of defense in fighting this virus. It's a good one, and we encourage it, but we still want you to follow the guidance, wear your mask, socially distance, wash your hands. But the data that's coming out, especially for the Oxford AstraZeneca, and I believe the Pfizer vaccine as well, is that even the first dose itself gives pretty good protection against catching the virus, and if you do, getting severe disease from the virus. But the trials obviously tested 2 doses and have looked at efficacy, particularly after you've had the second dose.
Great, very helpful, thank you. And I noticed we've got a question we've had pre-submitted, and it's about, well, I'm going to put 2 questions together. And one of them is asking, is the vaccine a panacea? So can I go back to life as normal once I've had it? And the other question was, once people have had the vaccination, when will they be able to hug their mum and loved ones and give them a big kiss? So an emotional question there. But yeah, is it a panacea? Can we go back to normal? Sai, did you want to try and tackle that one first?
Well, the simple answer is no. I mean, as Edwina just said, it's only part of kind of the multiple things we need to do in order to try and reduce the number of cases. So continuing with mask wearing, social distancing, hand washing, these are all the different aspects. I think particularly because we are starting at a level with very high number of cases in the country. And so, we still have to, you're still on a lockdown, the country's still on a lockdown. So we can't, we can't think that the vaccine is kind of the magic bullet that is going to sort everything out. But it is very helpful. We're in a much more positive and better place now, a year later. One, having treatments that we can use for COVID, and two, having the vaccine. But prevention is better than cure. So really, the vaccine is necessary along with all those public health interventions.
Great. Another great question. How long does it take for the vaccine to be effective? So once you've had the first jab, I presume, how long does it take for that to start, that protection to start to kick in? Can anyone let me know if they want to tackle that one? Brighton?
Yeah, so the immunity from the first dose is being said to be 2 to 3 weeks. So I would advise people that they have to be taking precautions. But as also Panacea says, as I already said, we just need, it's a tool to prevent and fight this. But we are not giving people the permission to say, okay, after 2 or 3 weeks, you can do whatever you want. No, that's not the message. The message is that you are now protected, but it's not 100% protection.
Great, that's really helpful. Did anybody else want to come out up on that one, or we've got another one about children coming up? No. Okay, so the next one is, has the vaccine been tested on children at all, and is it likely to be safe for children who are extremely clinically vulnerable, therefore shielding, so people who are children who are shielding at the moment, or at further risk from the virus? So this is about children, so nothing that we've kind of touched on yet, but does anyone feel like they can speak to whether the vaccine has been tested on children yet? As far as I'm aware, it hasn't been, but I might be wrong. Does anyone want to give any feedback on that?
The answer is no, it has not been tested on children. That is the answer. But whether it's safe in children or not, I think we don't know.
Okay, that's helpful.
Sorry, can I just add one thing? But in lots of vaccines that we give to children, they were never tested in children, right? They're never included in trials, because often people don't want to put their children forward for a clinical trial, right? But so many, if you think about so many diseases or infections that we don't really hear about now, like diphtheria, measles, mumps, rubella, these are all vaccine preventable, and they were never tested in children. It's just that the same science that is being used for creating all of those vaccines is the same that is used now. We know so much more now. So I would say that it's if you try and just think logically, that actually lots of the the vaccines that are part of the national immunization program were never included in trials, including children.
Yeah, really helpful. Thank you for that. Another question that we had pre-submitted was, so there's a lot of talk, especially tonight, around the new strains of the virus. So this might be a little bit unfair to ask you now, because there's obviously research going on all the time and we don't know yet. It's early days, but the question still is, what will the vaccine be effective against all the new strains of the virus? Bit of a big one there, but does anyone want to tackle it, even just to say that we just don't know yet? Tom?
I think you've probably got the answer there, that we don't know yet entirely. I think everybody who sort of works or has worked in coronaviruses for a long time knows that these viruses change and they mutate over time. That's normal business for coronaviruses. And given that we've had so much of this virus, SARS-CoV-2, it's not a big surprise now that it's starting to mutate. And really, with the great sort of sequencing work in the UK and other countries, we're starting to detect these different variants. The way that the vaccines are targeted against a specific part of the virus means that if that part changes, people worry about whether the vaccine or other drugs that work against that area will be less effective. So the main thing to take, I think, from people in the UK at the moment is that the dominant strain that's going around the UK, that's originated in Kent and has now spread in much of the UK, the vaccine looks highly effective against that. So people who want to get protection now need to take the vaccine because it works against that, and that's the one that's likely to put you into hospital and make you unwell, that's circulating now. As we know, there's been an introduction into the UK, particularly of a number of virus strains from South Africa, and a bit of change in the UK viruses to suggest that one type may not be as effective. The vaccine may not be as effective against that type, but that's still a relatively small number. And we don't know yet if the vaccine will still be effective at keeping you out of hospital, even with that new strain. So that data will come. But I think the message has to be, for the strains that we've got going around the UK at the moment, the vaccines look very effective against them. And actually, even one of the other vaccines that's going to come into the UK shortly looks very good against the South African strain. Actually, it's working as well. The Moderna vaccine looks like it's efficient there. And the vaccine companies predicted this and are already planning on the next stage of vaccines that will come out in a few months' time that will incorporate maybe changes in the virus in the UK and other countries. So it was predicted, people have planned for it, but at the moment the vaccine looks very good against the dominant virus.
Really helpful, some positive news. Thank you for that. So Alison is asking, is there any evidence that people with underlying autoimmune diseases are more vulnerable to severe disease with this virus, e.g. inflammatory bowel disease? Again, quite a specific one, but yes. So
the data, and I think someone mentioned this earlier, is that the real risk of severe disease appears to be with age as you get older. Diabetes and also obesity appears to be very much a link with severe disease. So of course, if people are very immunosuppressed, with for whatever reason, so autoimmune diseases such as inflammatory bowel disease, but also rheumatoid arthritis, these are the types of things that you could be more at risk. But when we look at the data from across the country, the age, diabetes, things like obesity and chronic kidney disease appear to be more linked with severity. So I think the message for those with underlying autoimmune diseases would be to, if the vaccine's offered to them, take it, and continue with all the interventions we were discussing earlier, with continuing with social distancing, hand washing, etc.
Great, thank you. And I want to move on to some practical questions people have been asking. Before I do, there is a question around what the other illnesses or other medications, does the vaccine interacts with. So I think the term is contraindications. So yeah, does anyone talk to that? Brighton.
Yeah, so when we are given the vaccine, there's no interaction that we are aware of. We are just asking people if they're on blood thinning medication. The reason why we are asking them for that is because they can get a bruise, but nothing more to worry about that. So in terms of medication, we are not even worried what one is taking. We're just giving the vaccine. So in short, no, there's no contraindication that we know or that I know about medication when we are giving the vaccine.
Great, thank you for that. So just moving on to these more practical questions that people have. So in terms of if you don't have a GP for whatever reason, can you still get the vaccine? I know, Edwina, you put your name next to that when we discussed that question before. Are you able to speak to that? You might need to just unmute.
So my understanding is that the patients are being called via their GPs. And when I first read that question, I kind of thought, we really want you to have a GP in the United Kingdom. It's part of the NHS. We want to encourage people to register with a GP anyway, to look after you and your overall health. This is a condition that can affect people like Sai has mentioned, who have obesity, who have certain other medical conditions more. So the first step is, the answer is, I want to encourage everyone to register with a GP for your overall health. But secondly, the data that the government draws on, pulls out to call people and arrange a vaccination is usually via a GP. You can also get vaccinated at other sites, like a pharmacy. Some pharmacists are offering this now, and big centers. But in actually reaching out to you and contacting you, we're going through a system, priority groups, and that data has been pulled from GP records. So if you're not really registered with a GP, you might miss the opportunity to be offered a vaccination.
And secondly, you might be able to follow up on this one as well. Is the vaccine free? If I get a call from someone saying they can give me the vaccine, they come to my house and they give it to me, and I just pay £20, is that kosher or not?
I think the media is already trying to tackle this. There are lots of people, unfortunately, trying to make a quick buck off people's anxiety. The vaccine is free to patients who are resident or UK citizens. And I believe I've even seen that we want to encourage everyone to come forward for vaccination. No one's going to penalize you if you're maybe seeking asylum, but you're eligible to NHS primary care services. It's free. You shouldn't have to pay for the vaccine at all.
Great, thank you. And in terms of where vaccinations are being carried out, so you've mentioned a couple of places. Is that the same as everyone else is hearing? It's sort of like GPs, maybe some pharmacists. Are there any other places where vaccinations are being carried out? Yes, Saeed?
Yes, there's some places of worship. So I know there's a temple in North London, and as I mentioned earlier, some of the mosques are acting as vaccination hubs. I just wanted to kind of follow up on what Edwina was just saying about the vaccine being free. I think anyone who is trying to if you're contacted by somebody who says, you've got to come and we've got to pay this amount for the vaccine, I think actually you should be involved, have the confidence to say, oh, that's actually illegal, and say to them, oh, please can I have your name, because I'm going to report you to the authorities, because I feel like preying on people's vulnerability, particularly at this time, is really wrong. And the people who are doing that should be penalised for doing so.
Really helpful, thank you for that. And I should mention to people, we have Sharmini in the chat, and I should have mentioned this at the beginning, but Sharmini is also a medical professional, and she's been furiously giving us lots of tips to put in the chat for people as well. So I should say that she is answering for us. So yeah, please do carry on. If there's anything that you want to ask or that's going through your mind, or a comment or anything like that, then do carry on and put those in the chat. And I'm just having a think where to go next with this. Yeah, okay. Right, so moving on to now, we've had a lot that's coming out, hearing in the news about certain groups. And originally when we did this, we had the idea for doing this a webinar live stream. We thought we wanted to really get to people who maybe from certain groups, people of colour who are at high risk, but actually hesitancy covers a wider range of communities, but specifically on this issue of certain groups that are at high risk. How important is it for them to get the vaccine? And what are you seeing for certain groups of different cultures or ethnicities in the way that the vaccine is affecting them? So maybe, yes, thank you. Saeed.
So as I mentioned, I work at Ealing and Northwick Park. So for those that don't know, that the boroughs that our hospitals serve are Ealing, Brent and Harrow, and very ethnically diverse, with a large proportion of people of Black ethnic background and Indian subcontinent, as well as Eastern European and Somali. And really, overwhelmingly particularly in the first wave, it was just very noticeable that when we doing a ward round, the patients we were seeing were of ethnic minority backgrounds, and that may well be due to exposure. We know that the National Health Service and a lot of those who work in social care are from those backgrounds, and also those who work in jobs that perhaps they weren't able to stay at home, or work from home. So as I mentioned, things like taxi driving. So we saw that in terms of exposure, these groups were more affected, and also these are often groups or communities that experience other ill health in terms of diabetes and hypertension and heart disease, and so I really feel that and what we're seeing from the vaccine data is that the uptake appears to be lower in particularly in Afro-Caribbean, Black, and Pakistani and Bangladeshi, I think this isn't about, these groups are more vaccine hesitant. There are very much good reasons, and not only historical reasons, but also present day reasons, with things like hostile environment and government, the way the government has behaved. But I think that shouldn't detract from that the message that we're trying to get across is that we want you to live. We want you, we are you, right? Like, I mean, so many of the patients I saw were healthcare staff, or could be my parents, like they're Indian, or so. I really think that that it should be more about encouraging rather than kind of dictating, you do this, and just being empathetic to why, as you say, why people have individual reasons for not wanting to take up the vaccine, because they're often they're very valid reasons, and they sometimes just need a one-on-one discussion with somebody, maybe even just somebody from their own community. That does much more than like a random doctor saying, you must do this.
Absolutely, and definitely picking up some of the points that Nilu made about understanding what people's fears are and worries are, rather than coming down hard on people or being too stereotypical. So that's really helpful. Yes, Nilu.
Just some of the emerging data on vaccination uptake has shown that within some of those communities that we're seeing the lowest uptake, the Pakistani and Bangladeshi communities and some of the African communities, When people were asked about their likelihood to take the vaccination, there was higher levels of resistance to the vaccination. But when they were asked a follow-up question, if your GP explained to you why you need to do this, or if somebody you trust explained to you, would you be likely to change your mind? And overwhelmingly, people were more likely to change their mind. So there's something there about a mismatch of the public health message and how it's reaching vulnerable communities. It's not having the same effect across all communities. Some people are receiving the message much more clearly than others. So something has to happen there about how we engage with different communities, whether that's at different age levels or different points of migration. It's not purely a language issue either. It's about trust, winning over trust, and creating a safe space for that dialogue to happen.
Absolutely. And Brighton, I know that from your experience, and part of the process is to also gain consent from people. Can you talk a bit about that?
Yeah. So basically what is happening is that this is something new that we are doing. Was those that have come from flu vaccination, it's a 2-minute in and out. But with this one, we are taking time to, first of all, inform the patient, talking about what this vaccine is all about, so that they make this decision voluntarily, and also they will make sure that they've got capacity to make the decision. So no one is being forced. The vaccine is being offered. We are explaining everything, and we are going above and beyond, just explaining so that people are fully informed. And what we are finding out is that those people that we have spoken with, a lot of them have actually, after even talking to them, they've agreed. No one has actually said no. And on other platforms like this one, and thank you very much for this platform, where we have actually spoken with people, explained these things, what we have found is that when there's lack of information, there is distrust. When there's lack of information, there is misinformation, and those conspiracy people will take advantage of that and start feeding people with wrong information. But if we do another survey this time, I'll tell you we're going to have a lot of BEM communities saying they want to have the vaccine. And for sure, they are having the vaccine now.
Good. It is. It's a lot about trust. And I think maybe after this last question, we'll talk about trust and how things have generally played out in the pandemic, but how this is actually a positive thing. But Nick is asking about, we have kind of touched on this a little bit. So the change in the time that you have your second vaccine. So some indications about when you should have it and how that's been changed and shortened from a couple of weeks to many more weeks. So does anyone want to talk about that change in when you have your second vaccination jab? And the question is about to clarify that really, but if you want to add anything more, then do feel free. Does anybody want to pick that one up? I'll pick Tom. Thank you.
So I think it is a key question, and I think you understand that people have concerns about a change in a vaccine schedule in terms of when the vaccines were utilized in the trials mainly, and when they were initially approved, there was a suggestion that you'd receive the second vaccine only a few weeks, about a month after the first vaccine, for optimum efficacy. Now, the UK did a slightly different approach based on let's try and get the most vaccine to the most people, particularly given the bad wave that we're on about. And that was a totally valid public health decision. The question that people had is, are you more vulnerable in that 3-month window whilst you're waiting for your second vaccine in terms of getting COVID because you haven't had 2 vaccines in a shorter period of time? Now, that data is only just emerging really to suggest that actually having a second vaccine a bit later may give you better immunity actually by waiting a little bit longer. And it appears that you do get reasonable immunity after that first dose of vaccine. So some other countries are not doing that. Other people think that's a bit too long, but most people in the UK recognise that was a valid decision. And the key thing that people need to recognise that, you know, whilst you might be waiting a bit longer for your second vaccine, still having 1 vaccine is a lot better than 0 vaccines, which is the case in a lot of places in the world. So, you know, that's my sort of take on it. It's a bit different from other countries, and sometimes, you know, when the UK has, you know, gone it alone or done a different approach to other countries, it hasn't worked out. but this is pretty valid and appears to be probably paying off.
Great, very helpful. Does anyone want to add anything further to that, or else we'll just move on to, I think, might have to be our last question now, and I might just get just a general comment from everyone. But yeah, one of the questions that did come up, I didn't want to ask it first, but it has come up in our report from last year. And it was, again, picking up on the idea of trust. And of course, there have been, we've got some terrible statistics in terms of how much the COVID-19 has spread in this country. And I know that some of the hesitancy has come from the fact that people aren't too sure whether generally the way that we've been able to deal with this means that the vaccine rollout will also, or the vaccine itself also shouldn't be trusted. So in terms of trusting the way the government or health services have dealt with it, the pandemic in general, can we delink that from how the vaccine has been rolled out? And should we be trusting this part or this strategy that the government is putting forward now? So any really last words on vaccination? So I'll just go round everyone, if that's okay. So Nilu?
Yeah, I think we should trust this vaccination rollout. For anyone who has said to me that we can't trust the government, look where we are now compared to other countries, I remind them that the vast work of this vaccination rollout is being done by our NHS, who we trust inordinately and who have seen us through all of the great calamities. So absolutely, we trust the rollout of the vaccination. And there's one other question, I think, previously about will behaviours change, or can we go back to normal? We've got a new normal now, and so we're going to emerge as much more resilient and much more strong when we go out into the new world. So we're not looking to go back to where we were. We'll keep to the best things and we'll move on to adapting to new things. We're going to fundamentally change the way we work, the way we study, and the way we communicate with each other. So it's a brave new world to look forward to.
Thank you. Jaya?
Yeah, I would just like to add that though, maybe our government hasn't done, we haven't, with regards to statistics and everything, we haven't performed very well with COVID, but the vaccination is not something which only the UK government is rolling out. These vaccines are being, given all throughout the world. Many countries have, approved, their regulatory bodies have approved these vaccines. So people can be confident, and take the vaccine if they are offered the vaccine. I think that's what I would like to add.
Great, thank you. Brighton?
I think we have to understand that over 120 million people have been vaccinated. Over 12 million have been vaccinated in the United Kingdom. And yes, there could have been some mistrust in the past, but at the moment, I think if you look at the panel here, we are all represented. People who look like you, wherever you are, we are here. And what we are saying is that we have realized the challenges, and this virus does not select you on whether your skin or your profession. We know from the Prime Minister to men in the street we have been affected. And what we know is that if you've had a relative, and if you ask people like Tom who are working in the hospitals, they've seen people dying. And when we have got a tool to prevent us from dying, I would not hesitate. I thought about it and I got myself vaccinated. Will it give me 100%? Maybe not, but I know I've got a chance of fighting it if I get it. So it's up to you out there. Think about it. What weapon are you using? There's a vaccine, there's the mask. Let us use all the weapons and save ourselves, save your family, save your community, and also save our health system. Thank you.
Very wise words. Thank you for that. Edwina?
Thank you, Brighton. It's very hard to follow on from that, but I echo everything that you said already as well. And I think for me, we can all look back with hindsight and say we could have done this better, we could have done that better, and we'll learn from the last year how we've managed the pandemic. But what we have right now, like everyone's mentioned in our arsenal, is this vaccine. I'm very, very grateful to be in a country living where we have the NHS and I don't have to pay for the vaccine, and everyone's being considered. Like Brighton said, regardless of your age, your ethnicity, what you do, when it's your turn, you will be offered the vaccine. I would strongly encourage you to go for it. If you have any questions that you feel are more individual, we've not had the chance to answer this evening, then I would certainly speak to your GP about it. But I hope that all the panelists have been able to answer most of the questions that people are worried about. But yes, I've been vaccinated. I'm pro-vaccinations, especially for this condition, because personally and in the community where I work, I've seen the impact acutely, but also long term. And whatever we have to try and prevent getting the infection or severe disease, I would strongly encourage people to go for it.
Thank you. That's really great. And Tom?
Not much to add, really. I think, as everybody said, it's safe, it's effective, and it's a really important tool to try and get us out of this mess that we're in, really. I think the only thing that I would add is that I think interaction and communication like this is really important. So, a lot of the concerns that people have aren't fake news. They're just genuine concerns where people are interested to know about the vaccine. And all the questions that we've had, I think, are entirely appropriate and valid questions. And this dialogue and communication that we need to have is really important to build this trust in the vaccine. So, no, I think it's super important. But the vaccine is a vital tool that we have.
Great, thank you. And Saeed?
Yeah, not much to add after everyone's great comments. Just to say that when I heard that vaccine was available and is shown to be effective, it's like one of the few times in the past year I've been happy. Really ecstatic to hear the news, because when you've seen patients, colleagues, members of family get ill with COVID, then you see how terrible this disease is, and having it in the, I think Brighton mentioned the weaponry of what we can use against it, is just so important. And I think, some people don't feel confident in this kind of environment, and in a webinar, even like posting questions in the chat. But if you can find somebody that you trust, be that your GP or members of your community, maybe members of your your religious community, to have one-on-one discussions, I would really encourage that, and encourage you to take up the vaccine. If you're hesitant, please ask questions. And yes, thank you for the opportunity to be involved in the panel.
Great, thank all of you. And last but not least, Latha, just brought you in for a few words.
Yes, thank you. I mean, just to echo what everyone else has said, really, but just to say, I think that this pandemic has been just such a terribly uncertain time for everybody, and it's just raised questions about all sorts of things in our lives. And I think the vaccine is just one is a part of that kind of that sort of demonstrates that difficulty. So if you have any uncertainties about, it's okay to ask. And I think, as everyone else has said, hopefully everyone will know somebody that they trust or that they can ask, and just get more and more information about what choice to make. And then you can use all of that information to make the right choice for you, not just for you, but for your loved ones and for everyone else that you know around you. So I hope that you're able to get that information and make a good decision. Thank you.
Thank you. Absolutely wonderful. So we've pretty much gone to time and stayed on time, and got so much in. I can't wait to actually watch this back myself. So yeah, it's just really for me to say a few thanks to my panelists. I will let them go now whilst I do that. But thank you all so very, very much. I just feel so honoured to have you and for you to spend your time. I know you're incredibly busy. So thank you all very, very much, and take care for now. So just bye everyone, bye. So just a couple of things to remind people. I hope you found that useful. Please do like if you did, and maybe we'll try and do this again. And if you are able to subscribe or like our page, that helps as well. I think it's really important that more people can hear from the voices we've had on tonight, because they are very believable and very much experts, but also really personable. I felt that they knew what they were talking about. They had experience, and like I said, I can't wait to watch it back. So please do share, reshare if you can, and a huge thank you to each and every one of them. We only had the idea to do this a few weeks ago, when we had a fantastic response. Different groups, BME, BAME, network groups, the BMA also shared it amongst their members, and others as well. So really thank you. Huge thanks to everybody who did that. So as I said, do like this if you found it useful, gives us an idea if it was helpful, and do subscribe if you're watching us on YouTube, or like our page on Facebook, and we'll try and get some clips of this out as well. If you want more information, we have got some useful links on our website, so coproducecare.com. And if you want to have more information, if we're doing anything like this again, or generally what we do in terms of live streams, then do email us at hi@coproducecare.com, and we can just add you to our mailing list. Now I'm going to disappear, but we do have more for you if you just want to hang on. Like I did explain, a couple of videos coming up. We're going to start off with a message from Thangam Demaner, Labour MP. Then we're going to move to a video from Professor David Katz, who I had a 10-minute discussion with around vaccination. So he'll be talking from his perspective, and then we'll share a couple of links which are specific for social care. So if you want to hang on and just have that playing in the background, or if you need to go and do something else and want to look at it later, exactly the same links that you've used to join us this evening, you can use them again to just scroll back and replay or play something again. So it's very simple in that way. But yeah, a huge thank you to all our panelists, because it's been really, really enlightening. And I will come off now and go ahead with our video messages, and hopefully see you on the next live stream that we do sometime soon. Okay, take care, everybody.
My name's Thangam Debonair, and I'm the Member of Parliament for Bristol West. And I want to talk to you about why we should all get the COVID vaccine as soon as possible, as soon as it's offered. It's been a really tough year. It's been hard for so many people, and sadly, tragically, so many people have lost their lives. And so many others are left grieving and unable to comfort each other because of social distancing and all the other things we're having to put up with. It's been tough, and as we go into the new year, we've started to have some hope again, because there are vaccines, in fact more than one, and that's because we've had brilliant scientists who've been working for years on these vaccines. They didn't just spring out of nowhere last year, and because there's so many people have been affected by this disease, it's been able to go through its trials with big numbers of people involved in the testing. And an awful lot of effort, money, resources and time has gone into making sure that these vaccines are safe. None of us wants to go through another year like the one we've just been through. So I urge everybody, whoever you are, as soon as you can, as soon as you get that notification, that phone call and that letter, please take it up. If you've got questions, ask your GP, ask your pharmacist, ask someone you trust, who's a medical professional who you trust. But please talk, please come forward, and please let next year be better than this one. Thank you.
So really delighted to have with us today Professor David Katz, who is going to be talking to us about a few questions that we've had come through. So starting off, Professor Katz, do you mind introducing yourself?
Thank you, and thank you for asking me to come and discuss this important question with you. I'm David Katz. I'm Professor of Immunopathology Emeritus at University College London, and I'm still active working there. I trained in medicine and have spent most of my working life researching how the immune system works and how the immune system can go wrong, and of course how we can harness the immune system to do positive things, as in the case of production of vaccines.
Great, thanks for that. So
in addition to that, of course, I'm the chair of the Jewish Medical Association in the UK, which is an additional role. And in that role, of course, I work with other faith community medical groups. And these other faith community medical groups have worked together on this particular topic a great deal because of vulnerability of our communities, but also because of the fact that the vaccine is of particular interest to us.
Right, so we'll start off straight away then talking about the immune system. How does it affect someone who has a reduced immune system?
The vaccine is dependent on an intact immune system. Obviously, the idea of vaccines is that you boost somebody's immune system in such a way that when they encounter an organism or anything else, they know how to respond to it. That's the basic principle. So if somebody's immune system isn't working too well, they obviously won't respond as well to the natural infection. And you've got to actually give them some kind of boost and some kind of energy in order to respond to when they're infected. So people whose immune systems are not in perfect shape, to a certain extent, are more in need of vaccines than those who are not.
And the flip side of that, we had a question a few weeks ago that asked, according to ONS, my immune system has a higher percentage of dealing with COVID-19 than that of a vaccine. So I suppose the question is, would that person need the vaccination in that case?
When they say a higher, what they really mean is that the person has a good antibody level. Now, the measure of how you respond to a virus, a bacteria, or a vaccine is not necessarily always one antibody. That's one easy way of looking at it, if you like. That you may have a high immune system, but the kinds of antibodies that don't neutralize, they don't stop the virus from actually causing its harm. They may not allow the development of, you may have a high immune system, but you still don't get enough of the so-called T cells that you also need for the response. So even if you've got an antibody response, it still does no harm and can do some good to actually have be given a vaccine.
Thank you for that. And I'm going to ask a question that has come up, but also is quite personal to me as well, because I am 8 months pregnant. But someone has asked, can I have the vaccine if I am pregnant or breastfeeding? And I know I've been told, because I'm pregnant, my immune system is affected, so I should shield more, or I should stay in more than I might have otherwise. So in that situation, pregnant and breastfeeding women, what's your opinion on that?
Well, there are a couple of issues about that. The one is the common sense argument. Obviously, when you're pregnant, you don't want to get infections and have infections either because they cause actually the fetus to be infected, but usually it's more because you don't want to have your body having temperature, having other adverse impacts on your body, and you not being in good shape when you're actually delivering or breastfeeding or whatever afterwards. So that's obvious. If you are, but the question is being given the vaccine a good or a bad idea? Now you must remember that vaccines are not all the same. There are lots of different kinds of vaccines, and they don't all cause the same kind of effects. If you're giving a virus that has been modified, made less strong, like, if you like, the cowpox that was used originally for smallpox, then maybe that might be a mini infection and might be not a good idea. If you're giving something that is effectively synthetic, something that's been made up in the laboratory to mimic a real bit of a virus, and we could talk further about which bit of the virus, if you're giving something totally synthetic, what are the chances of that converting either into an infection itself, or the chances of that actually causing an adverse impact on your pregnancy? And the chances of that causing an adverse impact on your pregnancy are minuscule, if at all. Now, there is one urban myth out there, one extraordinary urban myth out there, that actually the vaccines interfere with fertility and pregnancy. Now, you know, kind of that is a real urban myth, and it's based on absolutely extraordinary convoluted evidence that nobody has been able to confirm. What you have to remember is that when people say you shouldn't use some things in children, you shouldn't use some medicines in elderly people, you shouldn't use some medicines in women or in men, what that sometimes means is it's contraindicated. What sometimes means is that it's not just been tested properly and satisfactorily. So people who say, be careful about pregnancy and breastfeeding, what it means to a certain extent is that 100,000 breastfeeding women or 100,000 pregnant women have not as yet been given the vaccine. That's different from it's contraindicated.
Yeah, absolutely. Which is why something that I've heard is that some people in certain roles have been offered the vaccine who are pregnant. So things will change presumably as more people and more evidence is gathered. Going back to religion and faith, we have a question that's specifically around the Muslim faith. But before I ask that, can I just get you to expand a bit about the work that you're doing with faith groups and why some faith groups are quite worried about people not taking the vaccine?
Well, they're different questions. The work that I'm doing with faith groups is that, of course, faith and belief is part of our culture. And in fact, it's part of our culture that's often regarded as the unprotected, protected characteristic in its own strange kind of way. And there are within the British medical profession many medical groups that relate to faith. So there's a Jewish Medical Association, the Islamic Medical Association, there's Sikh Doctors Associations, and so on. There are lots of these organizations. Perhaps the best known maybe is the Christian Medical Fellowship, and there's also a separate Catholic one. So there are lots of these groups. And we do occasionally talk to each other and communicate with each other about all sorts of issues. And one of the issues that we've communicated about is about this issue, because there's an overlap, there's intersectionality between faith and ethnicity in the society. And it's, of course, probably not faith, but probably ethnicity, which has been heavily implicated in the questions relating to a higher morbidity and mortality, and the unacceptably high morbidity and mortality that's occurred in these groups, and in the Jewish community as well.